come in India, because I think India can learn from what's happened in the United States. So most of healthcare innovation in the U.S. has primarily been driven by insurance. Okay, so when we started, and people would laugh at me, like, who's going to use this thing? Why would I use a computer? It's going to slow me down, right? So then Y2K happened. So we, even then the penetration wasn't as high for the general market in eye care. But in the dental field, it was really high. And the reason it was really high in dental was they were all doing X-rays. And they needed a way to go view X-rays. So it got part of the, right. So back in the early 2002-03, suddenly there was an influx of imaging systems for ophthalmologists and optometrists. So you could do diagnostics with, you dilate the eye and take a picture of the eye. So a lot of the diagnostics in eye care are now electronic. And so that required integration. So, and also required them to actually have a computer in the exam room. So it was really the catalyst to get people to adopt EHR. So these vertical niches like eye care and dental took EHR adoption much earlier than sort of the general market. In hospitals, there's a company called Epic, which is Epic. It's a behemoth. And as a matter of fact, they competed with Medical Logic was the early entrant, and they lost to Epic because Epic built the whole system, which so Kaiser adopted. Yes. So Kaiser adopted, and suddenly they became big. But government is the one that's been the catalyst. So, and this started with the Bush era. So basically, during the Bush years, actually Bush's nephew started a company called Athena Health, which is, also Epic. So they started with this standardization of EHR. So there was a group called CCHIT, and they were promoting, let's become standard. So when Obama came, that same group transitioned over, and as part of the Obamacare, they reserved billions of dollars for paying healthcare providers to adopt an EHR based on a standard, which was a nightmare. We went through 3 years of nightmare. It killed innovation. But that has been a key catalyst. So now about 80 or 90% of the physicians in the United States are on an electronic health record. The next phase of standardization is coming on patient health portal. So secured access to patient for data for patients. That is the next wave of health IT. Okay, that's going to be the next big thing in the United States, where patients are coming in. I mean, I use it. I use this thing called MyChart. I can see all my results. I can communicate with my doctor. I don't actually go see him anymore. If I have an issue, I just send him an email. He sends me a recommendation, or he needs to change my med, and then he gets, I don't know, $40 from insurance company. Okay. So there's tools and technologies. Actually, there's a company, I didn't invest in this company, there's a company out of Portland called BrightMD that's developing these diagnostic systems that the patient will see. So let's say you have a cold, or, I don't know, having cough or something. You don't need to make a doctor visit. You can just do it online. Just communicate with your doctor online, send your problems, and they can say, hey, you don't need to come in, I'll just prescribe a medication, but pick it up from the pharmacy. There's integration. Yeah. So that's the next big wave, is bringing the patient into the fold of really electronic patient care. Another thing that's happening kind of behind the scenes is communication between the doctors, your record actually being kind of a centralized record. So there are these organizations called IHEs, or HIEs, where they become the repository for all medical record information. So if I'm a orthopedic surgeon and I need to get something from your primary care physician, I can just grab the record. I have all the information. As a matter of fact, Epic kind of already has that. So I recently had neck surgery, and I went to one hospital system that did my initial stuff, and before surgery I had to go through some tests. And then I decided I didn't want surgery there, I went to a different hospital system. And I had to tell them, hey, don't do those tests again because you probably have them in my chart, which they found, right? So that's a big cost saving, right? To not do repetitive tests. So the whole idea behind this new health standardization and also a common electronic record is that it reduces the number of repetitive tests that people make. If the data is already there with another physician, why do you have to repeat it? So that kind of stuff to lower cost. What's most exciting is this, wearable devices. And there's a lot of stuff happening in the US right now. There's a company that TiE Silicon Valley is funding that is like a watch that can detect, basically alert if somebody's having a seizure, right? So there's a lot of stuff happening on the wearable devices and all of this is going to be connected. But eventually, I think patients, the consumers in the United States, will have far more access to healthcare through electronic means. As a matter of fact, if you listen to Vinod Khosla, he will say doctors will be a thing of the past.
You will see a robot.
Pardon me?
You will see a robot.
You'll see a robot doing surgery, and you will not need a physician because this is where the artificial intelligence and IBM is. What's that?
Watson.
Dr. Watson.
The Watson, yeah. I mean, that's where Watson is going, right? So these are, and if you need a doctor to communicate with you, they'll come up on Skype. And a good friend of mine, his name is Dave Sanders, he runs a group of clinics called Zoom Care. He wants to come to India, actually. If anybody's interested, who's got that kind of background. So Zoom Care is out of Portland. They have disrupted the whole business of healthcare, primary healthcare in Portland and Seattle. You can make your appointment online. You show up 5 minutes before your appointment. You go see the doctor. Your doctor is not an MD. It's a nurse practitioner. If you need an MD referral, she'll get you an MD referral on the phone. If she needs to talk to a cardiologist, she'll get a cardiologist on the phone immediately. So they just cut down this referral visit. Like, oh, now let me refer, now you go talk to them. All the information is right in front of you. They email you the whole, whatever it is, your care plan, all that kind of stuff. And then when you walk out, there's a little dispensary and they'll dispense the medicine right then and there. So you don't even have to go to a pharmacy. So it's kind of going back to the old way, old days of how healthcare was, but it's all automated. So those kinds of clinics will be around for sort of what we call face-to-face visit, but they're going to be low-cost providers. You will not see expensive healthcare providers sitting in front of you.
Thank you, and it's a pleasure to meet Nitin in various places when he travels around in various TiE events, and I know that he has set up in Pune, and that brings him to Pune more often than not. And there are several other reasons that he told me eventually why he comes to Pune, including his being a disciple of Iyengar Swami, who just passed away a few days back. But when I met him and I said, whenever you're in Pune next, we've got to get you to tell your story. And I'm so happy that you are here today and you're able to share this with people that are here today. As you know, TiE is about global connectivity, and people like Nitin who take the time, travel out and share their expertise, contact, is what makes TiE what it is, global connected entrepreneurial network, which is, as we heard, the largest network of entrepreneurs anywhere. And Nitin, I'd like to thank you for sharing your story and being with us. Ajay has been an old friend. I have been trying hard to get hold of him to be a part of TiE, and this is one excuse for him to come out over and from his Hinjewadi location to be here with us this evening. Today I was really telling Nitin that with so much rain outside, I don't know if we're going to get people in the room, but I'm glad that we have such an interesting storyteller, and I'm happy that you are all here to hear his story. Thank you very much once again, and have a good evening.